let's bring in Dr. Farah Naureen from Islamabad. She's the Mercy Corps Country Director for Pakistan. Doctor, good to have you on the program. Just talk us through the types of needs that your organization is seeing in Pakistan. What are people desperately in need of right now?
Okay, so thank you very much for this question, and I'll begin by first explaining that this disaster, it has affected a major part of the country, and in some parts of the country, the situation is still evolving. To give you an example, we have water receding from the affected areas in the north, but if we go further south in the upper Sindh area and adjoining Balochistan, the flooding that took place, the water has still not receded, and it will take some time to recede. So the people in those areas are still in homeless conditions or in camps situation. And if we go further south, the most recently affected area is still underwater, and there's active rescue going on. So I'm saying all this just to explain the scale and nature of this disaster. That as we talk about the needs of the people, the needs will differ from places to places, and the needs will keep on evolving as well. People immediately, of course, are in need of shelter and food, going forward cash for their needs. But also hygiene items and what we call the non-food items to help them with their immediate needs. Health and water sanitation and hygiene are some of the key needs that they have right now. In some of the areas where people have started going back to their homes and the homes are damaged, their needs are different. They need support in cleaning those areas and building back their houses. If we go to Balochistan, where the highest number of livestock has perished, going forward, there's a major concern about their livelihoods, nutrition, and food security. Similarly, you have earlier in the show talked about the crops that have been damaged, the crops that have been lost, and the future crops in Upper Sindh, for example, that will not grow. This is going to be a very big concern for the country, for food security and also for nutrition. Yeah. Please.
I think it just the scale of this disaster is so difficult to comprehend because, like you said, the waters are still receding, and once they are really gone is when so many more problems are going to be revealed. And I would imagine that the country's healthcare infrastructure has taken quite a knock due to these monsoon rains and the subsequent flooding.
Yes, that's health, like I said, is a major need. The thing is, there are humanitarian organizations and humanitarian workers on the ground who are responding to this situation. The scale is such that there's plenty of work for each one of us to do. The donor money is being mobilized. There will be need for more money for immediate relief. And one thing that I would like to highlight is that with the immediate needs, which still are being covered with a lot of challenges, and there's still population that is in need of support. It is the recovery time that we are looking at, which is going to be very long and challenging, and we also fear that the world's attention may go down a little as the country moves towards rehabilitation and recovery, and that's where the country will need the biggest support and attention, because it's not going to be a very straightforward and an immediate recovery process. So I just wanted to highlight that as well. With the healthcare needs, currently in different parts of the country, there are mobile medical services being provided, but we also need to look at how quickly, timely, and with what quality we can provide these services to the population, and how quickly the health facilities can be rehabilitated so the primary healthcare services become available to this large displaced population.
Yes, so much is needed for the reconstruction of this country. Dr. Farah Naureen, live to us there from Islamabad. Thank you so much for your time.